welcome to the Gavel. I'm Linda Akibe. West Africa is experiencing the worst Ebola outbreak in history. In Nigeria, President Goodluck Jonathan has declared a national emergency on the control and containment of the Ebola virus in the country. So far, 4 people have died from the virus and 10 people have been confirmed with Ebola virus. During the week, the House of Representatives Committee on Environment met with some government agencies to brainstorm on actions to curb the spread of the disease. Watch.
It was an environmental intervention meeting convened by the House of Representatives Committee on Environment to brainstorm with relevant authorities on appropriate actions to curb the spread of the Ebola disease in Nigeria. The chairman of the House Committee on Environment, Mrs. Uche Kunife, said the Ebola disease is environment-related and Nigeria's concentration on curative care instead of prevention might be counterproductive.
We are convinced and determined that this disease is environment-related. Hence, the perception that it needs only curative care might be counterproductive, if not urgently nipped in the bud. We are very much aware that the virus is transmitted to people from wild animals and spreads in the human population through human-to-human transmission. Fruit bats are considered to be the natural host of the virus, while transmission occurs through handling of infected wild game like monkeys, gorillas, antelopes, etc. This clearly shows that the environment sector has a big role in the control of Ebola virus. And the only way we can tackle the virus is to ensure that the Ministry of Environment is empowered through their agencies, National Park that is in charge of all the animals that bring about the virus we are treating today. And that we also empower the environmental health officers, which we have as our environmental soldiers, that will go from house to house, market to market, church to church, all the areas, to ensure that not only that people are aware of what is happening health-wise, but also to educate people on the best way of managing their environment. In that way, they will manage their lives.
Key among the issues raised at this meeting were the need to tackle the root cause of the spread, reduce animal-to-human contact in Nigeria, and widespread enlightenment on sanitation and hygiene.
While the nation is dealing with the manner and way of curing Ebola virus, they must also pay attention to the root cause of the virus. If we do not tackle the root cause of Ebola virus, it is difficult for us to kill the virus in the system. The Federal Ministry of Environment should carry out massive environmental awareness and attitudinal change initiatives to improve citizens' knowledge, citizens' attitude and practice on environmental sanitation and hygiene. Why this one is necessary is that every end of the month, local government, states and federal will all participate in sanitation exercise. But after that sanitation exercise, the next day, the entire debris will resurface in areas where you have scooped them. Therefore, this is key and very important in our system. The Federal Ministry of Environment should carry out massive disinfection and disinfestation of public places in the country to limit spread of Ebola and drastically reduce bats and other pets in the system. The Federal Ministry of Environment to coordinate massive control of pets by ensuring the reinstitution of pet licensing to curtail possible zoonotic transmission of Ebola virus and related diseases.
Officers from the Environmental Health Council and the National Park took it a step further by asking for immediate review of waste disposal system and testing of host animals such as bats to ensure Nigerian communities are safe.
For the National Park, we would like to carry out what we call a preventive measure. That is to say that we would like to get samples of some of these animals, especially those believed to be carriers, such as primates, so that they can be able to test their blood. And if they are found actually, yes, they are carrying the virus, then, which means there is a need either to eliminate them.
But we should also look at other aspects of public crowd control. We should pass the message out. If you must not be there, if you cannot afford not to be there, don't go there, so that the crowd is reduced. Again, we are treating people in hospitals. By the time the doctors finish, they give injection, they use swab and all that. They remove the coats they are wearing. Where do those things end up? Our healthcare waste, with the era of Ebola, we cannot do business as usual, because the Minister of Health has succeeded in confining it to hospital grade. But if the things used to treat the patients ends out from the hospital and finds their way to one dump site and people scramble and sit and start using it, what will be the outcome? What have we achieved? So our healthcare waste management must, as a matter of urgency, be looked at.
The environmental health officials also made other recommendations that would ensure the Ebola disease does not become an epidemic in Nigeria, such as the control of avoidable public crowd and public enlightenment to stop Nigerians from the culture of visiting sick relatives. They also called for the expansion and review of the public health bill.
In those days, when somebody recovers from smallpox, the law provided that there must be a concurrent disinfection in the place where that person survived. And all the health people would do was come, seal up the place, all the things in the house, they would disinfect everything and give a number of days before people are allowed into such place again. Today, those laws, if you come to disinfect my house because my neighbor had Ebola, there's no law that will support you, unless, of course, Nigerians may cooperate. But if somebody proves difficult, what will you do? You get police to arrest him. Fine, you do that. He will go to court and say you violated his human right. But the public health law gave us powers that if public health is at stake, people's rights can be denied.
But beyond the recommendations, committee members wanted to know what efforts the environmental officers were already making to stem the possible spread.
We want to know why you've not done anything at all, or it never occurred to you that you have a big role to play, because the importance of your office can never be overemphasized in this kind of scenario. That's why I said we want to hear the proactive measures you have put in place to contain this, to ensure that the preventive measures are put in place.
The animals that we protect are said to be the carriers of this Ebola virus. You see, the problem is when you say something is a carrier, it's very difficult because it will not exhibit these clinical symptoms at the correct time, to give people signal so that such diseases can be treated.
The meeting ended with resolutions towards ensuring that the Ebola virus is tackled by concentrating on preventive measures rather than curative care. And to this end, they said a united effort is most appropriate.